Today, we're going to explore a really profound idea from Christopher Bollas's book, When the Sun Bursts. And, it tackles one of the toughest questions out there in psychotherapy. What does change even look like in the face of schizophrenia? So, let's dive right in.
It's a question that really gets to the very heart of healing, doesn't it? If someone's reality is just fundamentally different from the one we all share, is real, genuine transformation even on the table? Is it possible?
Well, psychoanalyst Christopher Bollas argues a really clear and honestly hopeful yes. And his work isn't just about, managing symptoms. No, it's about the potential for deep, fundamental change within a person. And he actually gives us a framework for how this can happen. All right, so first things first. Can schizophrenia actually be changed? Let's start with that big foundational question. What Bollas does is he kind of reframes the whole conversation. He urges us to step away from seeing it as just, a disease with a list of deficits and to move towards something much more human. And this quote really says it all. This is his starting point. See, before we can even begin to talk about change, we have to stop seeing schizophrenia as some kind of broken machine. Instead, we have to see it, as Bollas puts it, yet another form of being human. And that shift in perspective, it's absolutely the most essential first step.
So, if change is possible, where does it even start? According to Bollas, it's not about some clever technique or the latest medication. Nope. It actually starts with a very specific and very important kind of human connection.
Bollas basically argues that the foundation for any change is all about the analyst, the therapist. It starts with their way of listening. And we're not just talking about hearing words here. It's this deep, receptive state of mind, being able to tolerate confusion, to just sit with the patient's reality without judging it. You combine that with deep empathy and what he calls a basic human presentation, which really just means being a real, authentic person in the room, and that's what creates the safe space where the real work can finally begin.
All right, now we're getting to the real heart of Bollas's theory. The work in therapy isn't about teaching new skills or coping mechanisms. It's about uncovering the very building blocks of that person's reality. And he has a name for these building blocks: psychotic axioms.
So what exactly is a psychotic axiom? Well, think of it this way. It's not just a weird belief. It's more like a fundamental rule, a core assumption that structures their entire world. It's like the law of gravity for their mind. For instance, an axiom might be something like, "My thoughts are dangerous and can physically hurt other people." See, that's not just an idea. That's an operating principle that's going to dictate every single action, every word, every relationship they have.
So, here's the crucial takeaway. The goal of psychotherapy isn't to just add something new, like plastering a quote-unquote sane idea on top of a psychotic one. It's about something much, much deeper. It's about transforming those fundamental axioms, those rules that govern their reality.
Okay, so how does this transformation actually happen? I know it might sound kind of mysterious or abstract, but Bollas argues that this process, transforming a fundamental axiom, is actually something we've all experienced. He uses this really beautiful and simple analogy to make it clear.
Just think about the change from being an infant to becoming a toddler. An infant's whole world operates on a simple axiom. If I cry, food will show up. It's a rule. But as they grow, that entire operating principle gets replaced by a brand new one. To get food, I have to use words, I have to speak. The old rule doesn't just get tweaked, it's completely transformed into something new.
So a therapeutic axiom shift works on the very same logic. You take a disturbed axiom, that core belief that's structuring a private psychotic reality, and it could be transformed into what Bollas calls its non-psychotic alternate. And this is huge because this is what allows the person to finally step into a shared reality with the rest of us. This whole transformation process, it has a name. It's called structural change. And it's not a cosmetic fix, not at all. It's more like a fundamental rewriting of the self's entire operating system. It's a profound shift in the very architecture of the mind. Okay, this all sounds incredibly promising, but it brings us to a really practical and super important question. How can we possibly know if this kind of change is real and if it's going to last? What's the evidence of a new reality? What's the proof?
But really, what is the proof of change? What does this transformation actually look like from the outside looking in? Is it just that the person starts saying all the right things or suddenly starts acting normal?
Bollas has a very clear answer for this. He says the evidence isn't found in some test or in one specific behavior. The evidence is the altered assumptions that now govern this person's mental life and behavior. The proof is the change itself. It's in those new axioms that are now visibly running the show, guiding how the person thinks and feels and acts in the world.
So the really powerful idea to take away from all this is that change isn't an addition. It's not about adding something that was missing. It's a complete and total transformation of the self's operating principles. The whole system gets an upgrade.
And that really leaves us with a final and kind of mind-bending question to think about. If our deepest assumptions, the very axioms that build our world, can be transformed, what does that mean about the nature of reality itself? What does that say about the relationship between our minds and the reality that we experience every single day?